Action.
Hi, my name is John Anderson, and I'm going to do a demonstration today on how to change an IV to an IID. This is not intended to be a study aid for your lab testing. For specific instructions or specific questions regarding lab testing, please consult your critical elements. So the first thing that I want to do is I want to check the orders to make sure that the doctor has indeed ordered that we change the IV to an IID. And I have already done that, and it is done. So I'm going to go into the room, and I'm going to introduce myself to the patient. Hello, Mrs. Brody. I'm John. I'm one of the nurses here today. I'm going to change your IV and change it to what we call an IID, which is an intermittent infusion device. So what this is, it's an IV that's still going to be in your arm, but there's not going to be any fluid running through it. Okay? So now I want to check and identify the patient. Can you tell me your name? Okay, Victoria Brody. And Victoria, when's your birthday? 10/2/44. Okay, great. So the first thing that I want to do is wash my hands, and then I want to put on a pair of gloves, and I want to assess the site to make sure there's no infiltration or phlebitis, or if it's a medication running, any extravasation. And I'm going to do that by palpating over the site. So I'm going to palpate over the site. Mrs. Brody, any pain or anything there? Nope. And there's no redness, and it looks good. Okay? So now I'm going to take my gloves off, and then I'm going to get my supplies ready. Now the supplies that you need for this procedure are the gloves, which I used already. You need a vial of normal saline. You need tape, alcohol pads, a 2x2 or a 4x4. You need an intermittent infusion device, which is this here. And then you need a 3 ml blunt tip catheter. Okay, so we did all that now already. So the first thing that I'm going to do is I'm going to draw up my saline. So I'm going to take my vial, I'm going to clean the port with alcohol, and then I'm going to draw up 2 mLs of normal saline. Now on this catheter, there's no needle on it, it's just a blunt tip. All right? So we're going to clean our port, like we were taught in first semester, and then we're going to draw up 2 mLs of normal saline. And we have 2, and we'll take it off. Now what I'm going to do is I'm going to attach it to the IID, and I'm going to prime it. Now on the IID, this is the end where you're going to put your syringe, and then this is the end that's going to go into the patient. You want to make sure that you're unclamped. Now there's no reason to clean this with alcohol because you just took it out of the package and it is sterile. So we're going to attach it the Luer lock method. Screw it in there. And now we're going to prime the line. By priming the line, we're just going to get rid of this air and replace it with fluid. Okay. Now leave the whole thing in the package. Leave the syringe attached. There's a cap on the end of here. Do not remove the cap, because if you do and drop it, you have to start all over because you broke sterile technique. So just put the whole thing in here and leave it there. All right. Now the next thing that I'm going to do is I'm going to take a 2x2 or 4x4, and I'm going to place it underneath the insertion site, because when I change it, there's going to be some bleeding, and we don't want to get blood all over the bed. So now we're going to put it right under here like so, and that will catch the blood. Now I'm going to put on another pair of gloves. I'm going to bring my IID down to the bedside, and now I'm going to loosen up the cap, so when I go to put it on, I'm not struggling with that. So I loosen that up. Now I'm going to disconnect or actually I should turn the IV off first. Then I'm going to disconnect the IV, and I'm going to quickly switch it over to the IID. Once I get the IID in, I'm going to prime the line, or flush the line with 1 ml of normal saline. While I'm doing this, I'm going to look and make sure that there's no, the skin's not rising, or there's any pain or anything like that. Mrs. Brody, any pain? Nope. Okay, good. And I don't see any raising of the skin or anything here. So now I can disconnect the syringe, and now I can secure it down in place. And the last thing that you want to do before you're done is make sure that you are clamped off. Okay, does that feel okay, Mrs. Brody? Okay, good. Now you can get rid of your primary IV, because the patient has an intermittent infusion device. And that is in a demonstration on how to change an IV to an IID.